Hi, my name is Sanjay Gupta. I'm a consultant cardiologist, and this is More Than Just Medicine. So today I wanted to talk to you about atrial fibrillation and how it can affect your quality of life. We've already spoken about how it can affect one's length of life, and to all intents and purposes, it is reasonable to say that the best thing you can do to try and reduce your risk of strokes and thereby try and maximize your length of life is by going on anticoagulant therapy if you are deemed as being at a higher risk of having strokes from your atrial fibrillation. Today I wanted to talk to you about quality of life. Well, there are two ways in which atrial fibrillation can affect your quality of life. Okay, the first is that when you're in atrial fibrillation, your heart loses about 15% efficiency because the atria, the top two chambers of the heart, contribute by about 15% to the overall pumping ability of the heart. So if they stop working, the efficiency of the heart goes down to 85%. Now, most people are able to tolerate that, okay? However, some people, particularly those people who have weak hearts to start off with, may really miss that extra 15% that they were getting. So just losing that 15% can compromise the patient. How can it cause, what symptoms can it cause? It generally causes tiredness and breathlessness. So a person who has that extra atrial kick, that 15%, will be able to walk a certain distance, but if they lose it, they'll say, oh, I really struggle now, I get breathless, I get tired, I just don't feel like it. So that's one mechanism by which people develop symptoms from the atrial fibrillation, okay, i.e. the loss of rhythm. The second way by which people develop symptoms from atrial fibrillation is because of the heart rate. You may remember from one of my previous lectures that atrial fibrillation is a condition that affects the rhythm, but also the rate. Okay, so what happens is that when you lose the 15% that is contributed by the atria, the heart can sometimes race excessively or slow down excessively because as I used my oarsman analogy, the captain of the ship has stopped working. So there's no one to tell the 85 guys at the bottom how fast or slow to row. So you may be sitting there and your heart rate could be going at 120 beats per minute when it should go at only about 70 beats per minute. And when you start walking, the heart rate response to walking could be exaggerated. So for example, if I walked, my heart rate would go up from 70 to 90 beats per minute. In someone who has atrial fibrillation, it could go up from 110 to 160 beats per minute. And that will undoubtedly make that patient feel more tired and more breathless because they will feel, their body will react as if they're doing an activity to make their heart go that fast. So for me to get my heart rate up to 160, I'd have to do a jog. For someone with atrial fibrillation, they will feel like they've just done a jog even though they're just walking. And that's another mechanism by which patients develop their symptoms. So the first thing I would say is to try and control these symptoms. It is important to say, well, how much of these symptoms are being caused by the problem with the heart rhythm, i.e. just the loss of the 15%, and how much of it is caused by the heart racing excessively. And this is where it's very useful to have something called a Halter test, and also sometimes an exercise test, because what happens is you want to see what happens to the heart rate when the patient is doing his day-to-day activities and even maybe exercising. And if you can show evidence that the heart is going much higher, the heart rate is going much higher than you would expect it to, then that is the obvious mechanism by which the person is feeling tired or breathless. And if you can demonstrate that, then giving the patient medications such as beta blockers or digoxin to slow the heart down will improve some of the symptoms. However, in some people, even if you can control the heart rate, they still continue to feel a bit yucky. In those people, it may be worth contemplating whether it may be worth restoring their heart rhythm, i.e. giving them back that 15% that they've lost by going irregular, in the hope that that would improve their symptoms. How can you do that? Well, one mechanism is by doing something called a cardioversion, where you can deliver a small electric shock to the heart under general anesthetic and restore those 15 guys. Now, that can work sometimes, but if the atrial fibrillation is long-standing, then it's less likely to work. Another way of doing this is that you can consider something called an ablation, which is where someone can burn areas around the heart, particularly around the pulmonary veins, in the hope of getting rid of the atrial fibrillation. And for a lot of people, that can be that can really make a difference to their quality of life and improve their quality of life. Although the success rates of a procedure like this, particularly from one procedure, are low, around about 50%, and most people require more than one procedure. But those are the mechanisms by which people develop symptoms. People get their symptoms because their rate is not adequately controlled, or because their rhythm is not adequately controlled. For most patients, it's much easier to control the rate. But in some people, despite controlling the rate, the rhythm, just the fact that they're irregular, may make them feel a bit yucky. And in that setting, it is worth considering whether you try and cardiovert them or even consider something called an ablation. So I hope this was useful, and I'm going to put some more videos out on atrial fibrillation, and I'll talk to you then. Take care.